So the webinar is now live. We're waiting for people to roll into the attendees list, and so we'll just give it a minute or two while we're waiting for that. This is also the first time, those of you that are rolling into attendees and your sound's coming on, the first time we've done this setup for this seminar, and so you're part of a pilot program. You're part of a trial, and if there are issues, please put them, or something you can't hear or something you can't see, please put it in the chat, and we'll try to address it. So I'm seeing the attendees list is slowed and full for the past few seconds. Given that, and our panelist list is good and high, I'm going to start just by welcoming everyone. My name is Mike Welsh. I'm a professor of political science and assistant dean of the School of Sciences, Sustainability, and Health. This is the kickoff presentation for the Faculty Student Scholarship Seminar for spring of 2021. Some of you in the audience, some of you panelists are KSC 199 students. You've registered for this for that course. Remember to get your syllabus at the Canvas site for the course. And as we discussed last week, and as you'll see on the syllabus, attendance is worth 75% of the semester grade. And attendance is checked either by a random audit of on-camera participants or by scrolling down the list once or twice during the talk, which is something that I'll do. You and the students have been invited to participate and made arrangements to present on this webinar as participants. You can be seen by the presenter if the presenter wants, and we'll have the opportunity to ask spoken questions either during or after the talk in a more or less Zoom-like give and take. We also have an audience of registered attendees, 20 odd of them so far, who can't be seen or heard by the participant or the presenters. If you are one of these people and you wish to be a panelist and to have a mic and camera that turn on, Lynn Arnold or I can move your status so that you can become one if you let us know, with all the rights and responsibilities therein if you are. Otherwise, just enjoy the presentation. Ask your questions if you're an attendee in the Q&A so that Lynn and I can convey them to the evening's presenter. This evening's presenter is Professor Becky Dunn. She's going to be leading off the semester for us. Professor Dunn is a professor in the Department of Public Health, and she holds a BS from right here at Keene State College. She holds the titles of RD, Registered Dietitian, CNSD, Certified Nutrition Support Clinician, along with an MA from Immaculata University and a PhD from the University of New Hampshire. Her research and publication over the past decade has looked at the social, biochemical, psychological, and policy factors at work in promoting the choice of breastfeeding for mothers of young children. She's a few months just returned from a sabbatical research fellowship at the Children's Hospital of Philadelphia. Tonight, in a talk titled Evidence-Based Community Action to Support Breastfeeding Families in New Hampshire, Professor Dunn's going to discuss the application of this research to the support of the state where we live. Please join me in welcoming Professor Dunn. And I guess we'd clap if we were in a room, but yeah, we can clap. Thank you, Becky. Welcome.
Well, thank you for the introduction, Mike, and certainly the invitation. I'm delighted to kick off this semester seminar series by sharing the highlights of a 10-year project that I've had the great privilege to be a part of. So what I'm going to do over the next hour is I'm going to unfold a decade of community outreach, research, and evidence-based action to promote and support breastfeeding families in the Monadnock region and throughout New Hampshire. And the approach that I'll take to unfold this decade-long journey will include answering several questions, 4 questions actually. And what I want to just note is that you'll hear me refer to this research as our research or what we did, how did we move forward, because by no means was this a solo effort on my part. It was by all means collaborative with so many hands working on accomplishing this research question that we proposed just about 10 years ago. And I'll introduce some members of the research team, names that are very familiar in the Monadnock region, and then certainly here at Keene State. But to get us started as to how I will approach my presentation for this evening, I'm going to talk about what our research question is. I will talk about how we started and move forward. And this is going to tap into the community outreach and research aspect that I just mentioned. What answers did we uncover? And this will be through the qualitative and quantitative research that we've conducted. And then I'll spend time talking about the fun part in terms of how we responded through evidence-based action and community outreach. So our original research question that was posed back in 2011, and this was through a collaborative effort through a 4-person research team that included Dr. Rudy Fedrizzi, who at the time when we posed this question was the Director of Clinical Integration and Population Health at Cheshire Medical Center. Our research team also included Dr. Meg Henning, who is a professor of public health here at Keene State, and Dr. Carrie College, who was also at the time a professor of public health here at Keene State and is now the Dean of Sciences, Sustainability, and Health. So the 4 of us were interested in looking at this question. What are the factors that influence a woman's decision to initiate and continue breastfeeding in New Hampshire? And this question came at a time when the US Surgeon General's call to action to support breastfeeding was released, and the Healthy Monadnock Community Engagement Initiative was gaining momentum in building and sustaining a positive culture of health throughout the region. So in looking at Healthy Monadnock, and then certainly the call to action that was presented by the Surgeon General, it became very clear to us that it really does take a village to support breastfeeding mothers and families, communities, healthcare establishments, employment and childcare, especially when mothers are returning to work, and establishing a research and surveillance system at the national level, and then also at the state and local level, and then to develop public health infrastructure. So when looking at this comprehensive public health framework to promote and support breastfeeding, to ensure that the benefits of breastfeeding for mother and baby are maximized, we really wanted to take a look at how we can better promote and support breastfeeding throughout New Hampshire. Because when we look at the importance of breastfeeding, it's benefits for all. So benefits to mother and baby with regard to health benefits, and looking at the protective mechanisms against infections, such as gastrointestinal infections, respiratory infections, ear infections. It's also been proven to be an obesity prevention strategy for children later on in life. Type 2 diabetes, so a lower development of type 2 diabetes, preventing and protective against sudden infant death syndrome, asthma, certain types of cancers in mothers, and then certainly economic benefits. So we know that breastfeeding is free, but there's also economic benefits when it comes to healthcare savings. So when we look at those health benefits that I've just mentioned, the psychosocial benefits for enhanced maternal infant bonding, as well as a decreased risk for postpartum depression in women who breastfeed, and then certainly environmental benefits. So, when we look at all of these benefits, we think, well, why the call to action from the Surgeon General? And why are we, paying attention to this information if there's all of these benefits that are related to health, economics, the environment, and psychosocial? Well, when we look at the breastfeeding rates in the United States, they fall below Healthy People 2020 targets despite these benefits. And for those of you who are in the audience and are not familiar with Healthy People 2020, this is a national initiative to improve the health of the nation through disease prevention and health equity. And there's about 1,300 different objectives to reach these Healthy People 2020 objectives. And now that we're in the year 2021, we're now looking at Healthy People 2030. But when we started this research about a decade ago, we were looking at Healthy People 2020. So that's what my presentation will focus on this evening. So when we look at this and we looked at the breastfeeding rates, which is one of the objectives that's part of this initiative, we found that breastfeeding rates, typically they fall below these established benchmarks. And there are a number of reasons as to why these rates fall below the Healthy People 2020 benchmarks. And the barriers to breastfeeding have been researched and examined and presented in the literature in terms of spanning from a lack of knowledge to limited social public norms around breastfeeding, a lack of support, whether it be through family systems or through community systems or organizational systems, embarrassment by the mom, lactation problems and not perhaps having access to services or know where to seek support, employment and childcare issues. So when mothers return to work, may not necessarily feel that support, and then deficits in health services. So when we began to take a look at our research question, we wanted to begin to dig in and see, well, how do these barriers present in the state of New Hampshire? So we started to take a look at these benchmarks and the Healthy People 2020 target measures, which is in this column here. And there are a number of different target measures that are associated with breastfeeding. So women who have ever breastfed, so for any amount of time, so it could be a week, could be a month, could be 6 months. But then there's also target measures that capture exclusivity around breastfeeding at 3 months, exclusivity of breastfeeding at 6 months. There's also any breastfeeding at 3 months, any breastfeeding at 6 months, and then breastfeeding at 12 months. So when we began to take a look at the data to see, well, what's happening in the state of New Hampshire, what we began to look at in terms of here are benchmarks, we looked at overall the state of New Hampshire was doing really well. And again, what I'm referring to here is back in 2010, because when we started this journey, it was in 2011. And then at the end of the presentation, I'll have a little bit more of an update on some of the more recent data. But when we looked at where New Hampshire is at and how it compares to national data, the state of New Hampshire for ever breastfeeding was doing pretty well. So was the Monadnock region. And this data for the Monadnock region was captured from Cheshire Medical Center. When we looked at exclusivity around breastfeeding at 3 months, again, we were still doing pretty well overall as a state when we were comparing it to Healthy People 2020 targets, when we were comparing it to the US overall as well. And then exclusivity at 6 months, we were also doing pretty good. We were a little bit under the benchmark, but still pretty good. So we decided to take it a step further because as a state, we weren't doing too bad, but we decided to take a look at low-income women. So women who were eligible and receiving WIC benefits. And the data that we had available to us was from 2001 to 2008. And we began to take a look at this data and notice that there were some interesting trends with regard to the ever breastfeeding data. And what you see highlighted up here, this is basically just taken from the previous slide that includes the healthy, that includes ever breastfeeding with the Healthy People 2020 targets. So here we are with New Hampshire overall, and then breastfeeding at 6 months with Healthy People 2020 targets, and then New Hampshire overall. So when we take a look at this and we launch into 2008, we were falling short for women who were of low income. So overall in New Hampshire, ever breastfeeding 88.5%, but women of low income status were at 67% for ever breastfeeding. However, one of the more positive pieces to this was that women who were initiating breastfeeding, they were sticking with it as they continued on at 6 months. And we were finding that that data was at 24.6%. So not too far from the New Hampshire overall breastfeeding rate, and then not too far off from the Healthy People 2020 target rate. But what we wanted to begin to find is that we wanted to take a look at, well, why are we seeing this in New Hampshire? Why are we seeing this breastfeeding rate fall well below the New Hampshire overall average and certainly not meeting the Healthy People 2020 target? We also decided to dig a little bit deeper. So looking at the statewide data, we also had access to data by county. And we started to look at, well, what's happening in specific counties that are pertinent to, let's say, to us for the Monadnock region, which would be Cheshire County. When we began to look at that data, we found that Cheshire County and then counties that were surrounding Cheshire, so for example, just to the east of Cheshire County, which would be Hillsborough County, and just to the north of Cheshire County would be Sullivan County, those rates were falling below that 67%. So what we decided to do was to target our efforts around Cheshire County, and then just to the east of us in Hillsborough County, and just to the north of us in Sullivan County. We also found that Rockingham County, which is out towards the seacoast, and then Coos County, that's way up north, those rates were also lower than that 67% average. But in terms of what we felt we could geographically handle, we decided to focus in on those 3 counties for the initial points of our research. So in looking at the lower income breastfeeding rates, or the lower breastfeeding rates in low income women, we dug into the literature to gain a little bit of a better understanding as to why that's happening. And it's happening for a number of reasons, as you can see on the slide. But what we didn't have a good handle on is the specificity for New Hampshire. So based on this, we decided that we would use what we considered to be a logical approach to better understand our research question and to examine it through the lens of what's called the social ecological model. So, and this social ecological model is an in-depth examination of the personal attributes and environmental circumstances that influence health and decision-making. So not just saying that this is somebody's personal choice, but there's also other influential factors that can influence a person's decision on whether or not they breastfeed, or if they do choose to breastfeed, if they continue to breastfeed. So it takes a look at individual, interpersonal, social networks, so friends, family, organizational, so the environment in which somebody is, let's say, working in, or where they might go to school, community, so around cultural norms, social norms, and then at the policy level, which could be workplace policy, school policy, state policy, federal policy. So we decided in looking at our research question that we would want to take this type of a comprehensive approach to better understand what those factors are that influence a woman's decision to initiate and continue breastfeeding. So now that I've presented information about what our research question is and how we got to there, one of the pieces that we'll do next is we'll talk a little bit about how we started and how we moved forward. And our first strategy was to build a community coalition. So we gathered and built a coalition of breastfeeding advocates, professional scholars, and community members who would aid in guiding our research question and engaging in community action. And that was one of the really prominent pieces to our work, is that not only did we want to conduct research, we wanted to know how could we take action based upon the results of the research that we were able to get. So, and ultimately, the role of the coalition was to inform and engage a multifaceted approach. So the coalition was part of our community outreach, and that community outreach informed our scholarly endeavors, and our scholarly endeavors informed our community outreach. And ultimately, this was all to promote and support breastfeeding through evidence-based action. And our approach to our research was multifaceted using the lens of the social ecological model. And what I'm going to do is I'm going to walk through our first two research projects and just share some highlights as to how we got to this evidence-based action. So one of the very first steps that we took to better understand our research question was to engage in a qualitative assessment with field-based professionals to gain perspective on the barriers and contributors to breastfeeding that would ultimately inform a comprehensive survey. So, and this work involved facilitating 6 focus groups with field-based professionals. And these field-based professionals included lactation consultants, registered nurses, WIC providers, midwives, social support staff, physicians, and we conducted them at 6 different locations in southern New Hampshire. And really those locations spanned Hillsborough County, Cheshire County, as well as Sullivan County. And we conducted our focus groups using a semi-structured interview that had 5 questions that were organized around the social ecological model. Each of the focus groups was led by 2 facilitators, so a member of the research team with a student or a dietetic intern. One did the note-taking, and then one guided the flexible conversation with the participants in the focus groups. And then from the data that we gathered, we were then able to do a thematic content analysis to help us identify, analyze, and report out themes. And we were able to identify a number of themes, but then opportunities that presented themselves with those themes at each level of the social ecological model. So, and just to highlight, some of the themes that we uncovered and the opportunities that we uncovered with this focus group information, is we found that there were opportunities to educate mothers on a variety of different pieces at the individual level. So around sleep expectations, the benefits of breastfeeding, and then breastfeeding related policies at the state and federal levels. We also found that there were opportunities at the individual level of the social ecological model to guide mothers in establishing expectations around the time commitment that's necessary for breastfeeding and expressing milk, the potential discomfort that might happen, but then also the ability to trust their bodies. At the interpersonal level of the social ecological model, we also uncovered opportunities to educate families on the benefits of breastfeeding and then alternate ways to bond with the baby, that's just aside from feeding. And then opportunities to guide family and friends in establishing support for moms, and then providing moms with time and space to establish a breastfeeding relationship with her infant. Additional themes that we uncovered at the community level included challenging existing breastfeeding norms, increasing positive breastfeeding images in media outlets, increasing mom-baby group offerings, and then limiting exposure of infant formula advertisements. At the organizational level, we also uncovered opportunities around support for health professionals in communicating accurate information, providing support to postpartum moms if they've experienced a traumatic birth, providing support to moms if they are returning to school or to work sites, and then also support around early prenatal screening if mothers had a history that may preclude her from breastfeeding. And then at the policy level, we also uncovered a number of opportunities around enforcing and revisiting existing policies, and then to establish policies within organizations. So with all of this information, this rich information that we gathered from our focus group participants, this then informed the next step of our research. And this was to develop a comprehensive survey to administer to WIC mothers on routine clinic days in 3 New Hampshire counties. And for those of you who are in the audience who are not familiar with WIC, this is a federally funded program that's administered by states to pregnant women, to breastfeeding women, to postpartum women who are not breastfeeding, to infants, toddlers, and children up to age 5 if they meet the low income criteria. And WIC stands for the Special Supplemental Nutrition Program for Women, Infants, and Children. So in doing this work, this was going to allow us to better understand our research question around the factors that influence a woman's decision to initiate and continue breastfeeding in New Hampshire. So what this research involved is this was looking at the creation of a comprehensive 65 question scripted survey. And the questions that were part of this survey were categorized by the levels of the social ecological model. They contained 5 different sections around maternal characteristics, breastfeeding beliefs, social support systems that were in place, infant feeding practices, as well as information that had been received around breastfeeding. And many of the questions, about 60% of them, were at the individual level of the social ecological model. And this really aligned with the themes that we uncovered from our focus group, but then also was very consistent to what had also been conducted or done in prior research. Our work spanned 3 counties in New Hampshire, and it was the 3 counties that I'd mentioned earlier, Cheshire, Hillsborough, and Sullivan. And this makes up about 40% of the population in New Hampshire, where about 8.6% live below the federal poverty level, which is consistent with the state's level. And in this work, we individually surveyed 283 WIC mothers on routine clinic days. And the mothers that we interviewed, their breastfeeding status didn't matter. So it could have been moms who had never breastfed. It could have been moms who had breastfed for a week, mothers who had breastfed for 2 weeks to 3 months to 6 months to a year. So the breastfeeding status didn't matter, because what we were trying to uncover is the factors that influence initiation and continuation. So with these 283 moms, this represented 38 different towns in southern New Hampshire and 8 different WIC clinics. And once all the data was collected, it was categorized into breastfeeding initiation, so women who had either never breastfed or women who ever breastfed, and the amount and duration didn't matter, because our second grouping or categorization of the data was breastfeeding duration, so women who had breastfed less than 6 months versus women who breastfed for greater than 6 months. And to give you a little bit of a snapshot as to what we uncovered with regard to breastfeeding initiation and looking at maternal characteristics. And when we looked at these maternal characteristics, this spanned the individual and interpersonal levels of the social ecological model. So, and some of the things that we uncovered is that we found differences within our ever breastfeeding category for race. So what we found is that there was a higher prevalence of ever breastfeeding in non-white women as compared to white women. And then we also found that there were differences between the groups when it came to education. So a higher prevalence of breastfeeding was uncovered in women who had an associate's degree or higher, a higher prevalence in women who had planned to breastfeed prior to the birth of their baby. We also found a higher prevalence in women if they were breastfed as a child. And we found a higher prevalence in never breastfeeding if women had perceived breastfeeding as being painful. Also under the breastfeeding initiation group, and when we took a look at breastfeeding beliefs, which spanned the individual level of the social ecological model, we found that the ever breastfeeding group were more likely to agree with breastfeeding benefits. What you can see here is our ever breastfeeding group, our never breastfeeding group, with higher percentages agreeing to breastfeeding benefits. When we took a look at breastfeeding duration, so this was the other way how we categorized our data, and looking at maternal characteristics, and this spanned the individual, organizational, interpersonal, and community levels of the social ecological model, we found that a longer duration was associated with part-time employment, and it was associated with employment in general, but a longer duration was associated when we looked at within the category of longer duration, we found that part-time employment was associated with a longer duration. And however, when we looked at back here, whoops, I can just go right there. When we look at here, other, in terms of unemployed or staying home, we found that that was associated with a shorter duration, but the longer duration was associated with part-time employment. We also found that longer duration was associated with an increase in age, with a higher education level. Moms who had breastfed in public tended to breastfeed longer. And then we also found that women who had a higher number of encouraging people to support breastfeeding efforts also breastfed for a longer period of time. When we looked at breastfeeding duration and breastfeeding beliefs, and this spanned the individual, organizational, and community levels of the social ecological model, we found that longer duration group was more likely to agree with the statements that are starred in red. So they were more likely to agree with these statements that are starred in red around illness, obesity prevention, risk reduction for cancer for moms, and then convenience. And then women with a shorter duration were more likely to agree with these statements around formula being as healthy as breast milk. And then WIC benefits are better if not breastfeeding. And actually WIC benefits are better if you are breastfeeding. And then the most significant predictor of breastfeeding duration, so breastfeeding for a longer period of time, was age. So for each additional year of age, what we found was an 11% increase in the odds of breastfeeding for at least 6 months. And then also around breastfeeding duration, we collected some open-ended data about reasons for discontinuing breastfeeding. And those with a shorter duration, so less than 6 months, indicated that their supply and pain were the primary reasons for discontinuing, whereas those with a longer duration cited the age of the child. So, and then these responses spanned the individual and community levels of the social ecological model. So now that we talked about these first two steps that we took in our multifaceted approach in using the social ecological model to better understand our question, so based upon the results that we gathered from our focus group and from our WIC participants, we felt that we were ready to develop and implement evidence-based initiatives, which we grouped into what we kind of considered these 3 buckets. And how we grouped our data, and that this was going to help guide us in developing and implementing targeted evidence-supported initiatives. One of the first buckets where we kind of grouped some of our data into is we felt that we could definitely develop initiatives that worked on informing and supporting breastfeeding mothers, families, and organizations. And this would tap into the individual, interpersonal, and organizational levels of the social ecological model. Our second bucket for developing evidence-supported initiatives focused on improving the social and built environment, and this tapped into the organizational and community aspects of the social ecological model. And then our third bucket focused on developing, advocating for, and enforcing policies and practices. And then this hones in on the policy level of the social ecological model. So, and as we started to design these evidence-supported initiatives, another opportunity to further explore our research question was presented to us that centered on another action that was in the Surgeon General's call to action to support breastfeeding. And this focused on the action around childcare providers and childcare providers accommodating the needs of breastfeeding mothers and infants. And one might say, well, why childcare providers? What does that have to do? Well, when we take a look at the data around the number or the percentage of infants who are under 1 year of age and are in non-parental care, we're looking at about 45% of infants. And that percentage increases each year. And when we talk about non-parental care, we're looking at care in the home by a relative or non-relative or a center-based program. So we found that this was a really, phenomenal opportunity for us to expand on our research question, as New Hampshire was ready to take action on this particular area of the Surgeon General's call. And we felt that not only could we take a look at what's happening with low-income women and how could we design evidence-supported initiatives to improve breastfeeding rates in that population, but what could we do to also take a look at what's happening in the childcare environment. So Dr. Carrie College and I were awarded funding to accomplish the following in childcare. And this funding came from the Division of Public Health Services. And this is something that had never been done before. And we were being asked to assess the breastfeeding environment in New Hampshire licensed childcare centers. And then from that assessment, and also to take a look at what was existing in the literature and as well as what was happening in other states, was to develop a breastfeeding friendly childcare training and then create a breastfeeding friendly childcare award. And these last two bullets here, what we were being asked to do as part of the grant work was to think about how we can make this a permanent part of New Hampshire. So how can we make this accessible for childcare providers, but then also how can we make it sustainable? How can we make this have lasting impact? The first area that I'll talk about is how we went about assessing the breastfeeding environment. And again, this was something that had never been done in the state of New Hampshire. And with this first kind of prong is what I like to call it for this work that we did in the childcare environment, this first prong, we were on a very tight timeline, is that I think we were given maybe just about 2 months to do this assessment of the breastfeeding environment. So Dr. College and I knew that we had to keep this very brief and that we had to do this quickly. So what we landed on is we created a 26-question telephone survey, because when we uncovered that 576 of our New Hampshire licensed childcare programs provided infant care out of the 900, we knew that we had to do something accessible and something where we wouldn't be able to travel to all of these different centers. So we landed on the telephone survey. The questions that we developed focused on breastfeeding policies, practices, and knowledge of early childhood providers. And in the short time frame that we had to do this assessment, we were able to complete surveys with 160 New Hampshire childcare programs throughout the state, which is about a 28% sampling, so not too bad. And we had representation from all 10 New Hampshire counties. About 3/4 of the centers who participated were center-based, and then about 1/4 of them were family-based or home-based centers. And through this telephone survey, we were able to uncover a number of existing successes that were already in place in the childcare centers that we had surveyed. About 100% offered the option of feeding breast milk to babies in their care. About 84% reported having individualized feeding plans for breastfed babies. And then there was a high level of confidence that early childhood providers were handling breast milk correctly. And then a very high percentage were welcoming mothers to come in and visit throughout the day and to breastfeed or express milk and then have a designated space for them. However, we also found that there were a number of opportunities that presented around breastfeeding policy. Only about 22% of the centers that were surveyed had a breastfeeding policy in place. 28% posted breast milk handling and storage guidelines where bottles were heated and stored. 31% had visible breastfeeding promotion messages. And then only about 22% received formal training on how to care for breastfed babies. There were also other opportunities around providing instructions for parents on how to store and label milk. And only about 28% reported having learning and play materials that normalize breastfeeding. And then we had a pretty high percentage of our participants who were interested in a breastfeeding training. And then they were also interested in having a breastfeeding friendly designation. So this then led us to the second prong of the grant work that we were doing in the childcare environment. And this was to develop a breastfeeding friendly childcare training. So, and what we really had to consider was certainly the assessment results that we had just collected, our review of the literature, and we wanted to consider accessibility, and we wanted to consider how can we make this permanent. So when we talked through as to what approach we might take to make this a lasting training that's available to childcare providers throughout the state, what we ended up landing on was an asynchronous 90-minute e-learning program. And it's available, it's still available today through the free version of the Canvas Learning Management System. The content includes the benefits of breastfeeding, supporting breastfeeding mothers and families, handling breast milk, feeding breastfed infants, and breastfeeding friendly policies. And this is all specific to the childcare environment. So in this e-learning program, and I would just love to give a shout out to Lynn Arnold as she designed and narrated this online breastfeeding friendly training. So when we went to go ahead and launch the e-learning program, one of the things that we wanted to do before we made it accessible to everybody in the state is that we had it reviewed by the New Hampshire Breastfeeding Task Force and 40 early childhood professionals for feedback. So we were able to receive feedback on the content of the training, the technical aspects of it, what could improve. And then once we had that feedback and then we were able to implement the refinements, we mailed an invitation to those 576 licensed childcare programs in the state who provide infant care. So, and one of the things that we also decided to do, and even though this wasn't part of the scope of work within our grant, we also invited participants to participate in a voluntary opportunity where they could complete a pre and post assessment of breastfeeding knowledge and practices. And it was going to provide us with a way to see if whether or not this training improved early childhood professionals' breastfeeding knowledge and practices. And that's what I'm going to talk about just for a few moments, is what we ended up uncovering as a result of this pre-post assessment. So what we did, when we mailed the invitation out, we invited early childhood professionals to self-enroll and complete an 80-question pre-assessment. And you might think, 80 questions? Are you kidding me? Well, it was mostly yes and no questions, and then questions that were on a Likert scale. So for example, agree, unsure, disagree. So it wasn't as if it was a fill in the blank or an essay type of format. It was pretty simple to complete. And once the participants completed the pre-assessment, they then went ahead and completed the e-learning program. And then they were reminded 3 months later to return and complete the post-assessment. We had 249 early childhood professionals who enrolled, completed the pre-assessment and the e-learning program. And of those 249, 114 returned for the post-assessment. So in how we evaluated the knowledge and practices pre and post of those 114 who did the pre-assessment, did the e-learning, and then did the post-assessment is we categorized questions by changes in breastfeeding knowledge of the early childhood professionals who participated, and then changes in breastfeeding practices in the childcare environment. We examined data by who switched from yes to no, no to yes, unsure to agree, unsure to agree, unsure to disagree, and so on and so forth. And what we uncovered around breastfeeding knowledge we uncovered that we saw some statistically significant shifts in breastfeeding knowledge of our early childhood professionals who participated. So shifts in breastfeeding knowledge, so moving from unsure in the pre to agree in the post around these different areas of breastfeeding knowledge. So whether we were looking at breastfeeding or breast milk serving as an obesity prevention strategy later on in life for children, assisting mothers in losing the postpartum baby weight, the reduction risk in certain types of cancers for women, saving on healthcare costs, we found that we saw a statistically significant shift in breastfeeding knowledge in several categories. And then also a shift in pre to post in breastfeeding knowledge, moving from unsure to disagree in these two areas. And this is what we would want to see. So WIC benefits are actually better for women who breastfed or breastfeed. And then breast milk is a reimbursable component of the CACFP infant meal pattern. And then we also saw a statistically significant shift in knowledge from pre to post, from disagree to agree on breastfeeding, saving money on healthcare costs. So we saw improvement in knowledge. And then we also saw improvement in breastfeeding practices around the handling of breast milk. So shifting from no to yes, so pre to post. So around handling of breast milk, around visible breastfeeding promotion messages, around the availability of learning and play materials, and then having a designated space available for mothers to either breastfeed or to express milk. So what these results told us is that we saw improvements. We saw improvements in early childhood professionals' breastfeeding knowledge and practices. However, we feel that opportunities exist to replicate these results, but then to take it a step further and to determine if the e-learning platform is actually effective. Because we did not have an intervention and comparison group, we can't say that the e-learning platform is an effective platform. What we do know is that we did see improvements in breastfeeding knowledge and practices. And one of the things that we also found was that even though we saw these shifts in knowledge and practices, there are still opportunities for targeted initiatives to further improve the childcare environment. So for example, in one of the practices that I mentioned where we had seen a statistically significant shift in practice around the availability of learning and play materials, even though we saw a shift in practice, we still had about 50% of early childhood professionals who responded no to having the availability of those learning and play materials. So, certainly opportunities exist to improve knowledge and to improve practices. And one of the things that I just want to note that's listed here at the bottom of the slide is that to date, more than 1,200 early childhood professionals have completed the e-learning program. So it's still up and running strong, and it's housed on the New Hampshire Department of Health and Human Services website and available free of charge to early childhood providers throughout the state. And we even have childcare providers outside of the state who have accessed it as well. So, and then the third prong that was part of this childcare research, and I'm going to hold off on this and share some more information about this when I talk more about the evidence-based action, was the creation of the Breastfeeding Friendly Childcare Award. So stay tuned. I'm going to talk a little bit more about that in just a moment. And that's where we are going to land on this fourth question. So how did we respond? So we talked about our research question, how we started and moved forward, the research that we've engaged in. So now this is the real fun part when we talk about what did we do with all of these results? Well, we put it into action. We put it into action and we did community outreach. So to bring you back to those three buckets that I had mentioned. So we had all of this data. What did we do with this data? Well, we put it in these buckets to help us target evidence-supported initiatives that span all dimensions of the social ecological model. And what I'm going to do is I'm going to highlight with each of these buckets the evidence-supported initiatives that we've done over the last several years. So to take a look at this first bucket around inform and support breastfeeding mothers, families, and organizations, one of the things that our research indicated was that there are opportunities to enhance breastfeeding education and beliefs to help guide decision-making around intentions and durations. So what we did is we prepared a brief report that summarized our responses from the WIC survey. And we distributed that report to healthcare agencies in the counties that we had targeted, so Cheshire, Hillsborough, and Sullivan counties. And the messages were very short, brief, to the point, but what they did was they emphasized certain messages that providers could spend a little bit of extra time reinforcing when they are meeting with their patients, with their clients, and also dispelling any kind of misconceptions. Also under our first bucket, our research indicated opportunities to provide mothers, families, and organizations with information about breastfeeding. So what we did was we collected and compiled information from 12 local organizations that support breastfeeding, and we created a breastfeeding resource guide for the Monadnock region and beyond. And this guide was distributed to members of our coalition, which has had up to 40 members that were part of it. So it had a widespread dissemination. We also distributed the guide to local child care centers, and it was published on 2 occasions in Parent Express, which is a local newspaper that's part of the Keene Sentinel that comes out and focuses in on various young child and childhood, different childhood opportunities. And then also under that first bucket, as a way to inform and support, we hosted a film screening of the breastfeeding documentary, The Milky Way, that was open to the public, that was free and open to the public. And this documentary centers on having women feel empowered to trust their bodies when it comes to breastfeeding. And this was followed by a 4-member panel discussion of breastfeeding advocates. And then under the first bucket, one of the last things that we've done is that we have now a manuscript in queue for the peer-reviewed journal Young Children that focuses on strategies and resources to establish breastfeeding friendly practices and environments in the child care setting. And this particular peer-reviewed journal has a large audience of readers. So it reaches about the 60,000 members of the National Association for the Education of Young Children. And really what the intention of this article was to provide best practices on setting up a breastfeeding friendly child care space. And taking a look at the second bucket around improving the social and built environment based upon the data that we obtained from the research that we've conducted, it indicated opportunities to improve the availability of learning and play materials in childcare settings. So what we did is we created and distributed a listing of learning and play materials to normalize breastfeeding in childcare settings. And this listing was published in Parent Express. It's available through the e-learning program. And then we took it a step further and we obtained funding to purchase and distribute learning and play materials to local childcare centers throughout the Monadnock region. Under this second bucket, we also found that our research indicated opportunities to improve on posting breast milk handling and storage guidelines in the childcare setting. So what we did is we created a storage guideline magnet and distributed that to childcare centers. And we also included a downloadable handling and storage guidelines for childcare providers and families through the e-learning platform. We also found in our research that there were opportunities to improve public breastfeeding promotion messages. So we created a breastfeeding welcome here window cling that has been distributed to childcare programs, employers, businesses, and healthcare agencies. And then one of the other components that we did is we were able to obtain funding to commission 2 local photographers to photograph breastfeeding mothers and children, which we unveiled at the Milky Way film screening. And then we were able to rotate community locations for the photographs as a way to depict public breastfeeding as normal, natural, and part of a healthy community. And if you've noticed throughout the presentation, all of the photographs that are in the presentation are with real live moms from the Monadnock region and their infants. And then here is a sampling of a few more of those photographs, which were taken by our photographers in various locations throughout the Monadnock region. And some of them are on display. So maybe you'll have seen this one on display in the food co-op right here in Keene. And some of them were taken in local parks and then within studios. And then our third and final bucket was to develop, advocate for, and enforce policies and practices. And one of the things that I just want to mention, and that all of these initiatives that I'm talking about, these were led by members of our research team as well as members of our coalition. So I can't take credit for leading all of these initiatives. I've been a part of some of them, but certainly this has been a very collaborative effort. So our research indicated opportunities when we look at the enforcing policies and practices. It was to partner with organizations to develop breastfeeding friendly policies as well as practices. And some of the initiatives that we took were to establish breastfeeding policies at Keene State and Cheshire Medical Center. And I give credit to Dr. Meg Henning for leading that charge here at Keene State. And then a healthy monadnock breakfast was hosted that focused on supporting mothers in the workplace. And this breakfast actually became the incubator to workplace lactation initiatives that have been led by two of our public health faculty, Dr. Meg Henning and Dr. Amanda Hickey, and I'll talk a little bit more about that in just a moment. And then also under this bucket, a healthy monadnock indicator was developed around breastfeeding initiation and any breastfeeding at discharge. And then the baby-friendly hospital initiative was re-energized at Cheshire Medical Center and attained. And then we also included breastfeeding policy information and samples in the e-learning program for our child care centers to access. In the last area around develop, advocating, and enforcing policies and practices, our child care research indicated an interest in a breastfeeding friendly child care designation. And this was also part of that third prong of the child care research work that we were doing. So what we did is we partnered with the New Hampshire Breastfeeding Task Force to launch the New Hampshire Breastfeeding Friendly Child Care Award, because one of the components to that grant work, if you recall, was to make sure that we had a permanent platform, not only for the training, but also for the Breastfeeding Friendly Child Care Award. So in different centers, any licensed New Hampshire Child Care Center is eligible to apply for this award. They have to complete a 15-question self-assessment that shows they have a breastfeeding policy in place that is shared with families, that it's communicated with staff, and that they have practices that support breastfeeding, such as education materials, so materials for staff, materials for families, but then also learning and play materials for the children that attend their center, that their staff participates in at least one training every 2 years, and that they also have a welcoming environment. So in to date, we have awarded 17 centers since 2014 throughout the state of New Hampshire with this breastfeeding friendly childcare designation. So with all of this work, how is New Hampshire doing with breastfeeding? Are we addressing those factors that influence a woman's decision to initiate and continue breastfeeding? So in looking at this table, in the blue shaded area, this is the data that I had presented at the very beginning of the presentation. So in looking at Healthy People 2020 target measures, and then when we begin to jump over here, this is more recent data from 2018 and 2017. So when we begin to look at, are we meeting the benchmarks? How have we done? Have we seen improvements? New Hampshire has held steady. We've held steady over the last 8 years in terms of ever breastfeeding, where we're right around 88.3%. So we're above the target for Healthy People 2020. And then we've had quite a bump in exclusivity at 3 months. We're certainly well beyond the Healthy People 2020 target measure. And then certainly we've had a bump at exclusivity at 6 months. And that's certainly beyond the Healthy People 2020 target measure. And then we've also seen improvements in ever breastfeeding. We haven't quite reached the healthy monadnock target that we had established, but we're right around 91%, and we have some work to do around exclusivity at discharge. Whoops. And then when we take a look at breastfeeding rates in New Hampshire, so this was some really compelling data that we had looked at when we originally started our research, when we saw that 67% of low-income women were only initiating breastfeeding or had ever breastfed. So where we are to date is we have jumped up to 74.6%. We've gone back a little bit from 2017 where we were up to 75.2%, but we have jumped up to 74.6% since 2008. So over a 10-year period, we've seen about an 8% increase. And when you look at Cheshire County over this time frame, we've done some great work. So we've gone from 63.8% in terms of ever breastfeeding for low-income women, and we're up to 80.8%. And we've seen increases in most of our counties throughout New Hampshire in our low-income population. However, this is only a slice of the pie of what's happening in New Hampshire. So, we'd love to take credit for all the credit for this, but we can't. There's just phenomenal work happening throughout the state of New Hampshire. And I'd like to just share a few highlights before I finish up for this evening of some of the great work that's happening around breastfeeding in New Hampshire. So when we look at live births at baby-friendly hospitals, in the state of New Hampshire, about 49% of our live births are at baby-friendly hospitals. When you compare that to the national average, it's only at 28%. And for those of you in the audience who are not familiar with a baby-friendly hospital, that is a prestigious recognition that hospitals can achieve when they successfully implement best practices around infant feeding. And much of that comes through the 10 steps to successful breastfeeding. And New Hampshire has a very prominent statewide collaborative where they work with hospitals and healthcare agencies to implement those 10 steps to successful breastfeeding, which is why we see those live births at baby-friendly hospitals in New Hampshire at 49%. 11 New Hampshire hospitals offer pasteurized donor human milk. So this is an option for medical supplementation for breastfed babies if they need it. And then when we look at New Hampshire State MPINK score, it's 90. And how that compares to the national average, it's at 79. And when we look at the MPINK score, this is a Centers for Disease Control and Prevention survey that's administered every couple of years to hospitals who provide infant care, who have maternity practices. And this survey looks at maternity practices in infant nutrition and care. And then we also have, as I mentioned earlier, we have worksite lactation research and initiatives happening throughout the state. So my colleagues in public health, Dr. Henning and Dr. Hickey, over the past 3 years have assisted 30 employers throughout the state of New Hampshire in establishing lactation spaces through Division of Public Health Services grant funds. When we also take a look at the other incredible work that's happening throughout the state of New Hampshire, WIC has a positive influence on breastfeeding, and this is through their breastfeeding promotion and education activities, their peer counselors. And one of the things that we found interesting when we did our WIC research is that 71% of our participants in the WIC study had intended to breastfeed, but actually more breastfed. 78% actually did. So again, I think this speaks to the positive influence that WIC has on breastfeeding throughout the state of New Hampshire. And then also in New Hampshire, to support breastfeeding efforts, we have a Go Knapsack initiative, and Knapsack stands for Nutrition and Physical Activity Self-Assessment for Childcare. We have had over 100 childcare centers who have participated in Go Knapsack, and I have the great privilege of coordinating this project. And one of the self-assessments that childcare programs can complete is one that focuses on infant nutrition and breastfeeding. And we find that early childcare centers will focus on improvements in breastfeeding policies and practices if they choose to do that particular self-assessment. And then I would be remiss if I did not recognize our incredible New Hampshire Breastfeeding Task Force. So we have a very robust, engaged, and dedicated task force with over 50 members with goals that center on education for healthcare professionals, families, employers, childcare. They have expansive partnerships all over the state. They engage in advocacy at the policy level, particularly around legislation. And then they have a very robust infrastructure. And before I open it up for questions, a couple of things that I would like to share in terms of how I envision my research moving forward is that I would love to return to the e-learning program and use a qualitative approach with early childcare professionals who've recently completed the training, let's say within the last 6 months to a year, and do some type of a qualitative approach, whether it's a survey or whether it's a focus group, to see what's been useful, what can be improved, what should be included at this point in time, what might be removed. And I think this would provide an interesting perspective, particularly now that we're in the era of COVID, and then implement those refinements and then take it a step further and determine the effectiveness of that e-learning platform by having an intervention and comparison group. And then also some future directions in terms of some next steps that I see for my research is I'd also be interested in further exploring food insecurity and breastfeeding behaviors in New Hampshire. So those are some of the areas that I see on the research horizon, and we'll see where those take me and who I can recruit to assist in these efforts. And then I would like to certainly acknowledge the generosity from various funding streams over the last 10 years, and that this work would not have been possible without the generous support from numerous avenues. And then certainly, as I mentioned, this has by all means been a collaborative effort. This was not a solo effort. My partner in crime for the last 10 years on all three of these projects has been Dr. Carrie College, and then Drs. Fedrizi and Henning. I've had the great pleasure of working with on the focus group work with the field-based professionals, as well as the WIC survey, and then numerous other individuals and organizations who have dedicated their time and energy on the promotion and support of breastfeeding throughout the state of New Hampshire. So many thanks to everybody. And then if time permits, I'm happy to take some questions. Thank you for tuning in to our first seminar series of the spring semester. And like I said, we can open it up for questions.
Yep. And this is where we would clap if we were in a room. So I'd do that again.
Thank you much.
And I guess, this being the first time we've done this, there's a number of places that questions or comments are coming from. And I see some in the Q&A that maybe are just worth posting out there and using as a start. And then if people that are attendees or panelists want to put their hand up and ask questions, then we can do that too. As far as the Q&A goes, I have there's a shout out from Marie Duggan to the KSC Child Care Center, CDC, for being breastfeeding promotional and making it possible. I didn't realize that, but I know that people are very much in love with that place, and I can see why. But she also asked a question that I think is very interesting and sort of goes back historically. Why did women stop breastfeeding in the United States and historically, and when did that happen?
So, in terms of the specific time frame, I don't have a date that looks at when those levels dropped off, but a number of barriers present themselves, and those barriers can be the ones that I had mentioned early on. Some of that can be related to mothers returning to work and not feeling that they have the time or the space to express milk, to store milk, or perhaps are given the break time, but some of that has changed through federal and state policy. And some of that could be related to perhaps a childcare environment where they might not feel as if it's something that a childcare provider can provide when it comes to caring for a breastfed infant. Some of it could just be around social norming, where women may not have felt comfortable in breastfeeding in public spaces or breastfeeding in front of families. And then some of that could certainly be related to just what has been part of someone's culture. So whether or not they were breastfed as a child and whether or not they were going to have some support systems in place, because it certainly takes a support system in place to be successful in breastfeeding. And then, one of the things that can also occur, and this came up in some of our research in terms of a reason for discontinuation, was around pain and discomfort. And it shouldn't be that way. So there's supports that are in place with extraordinary lactation consultants and women who are providers who specialize in breastfeeding care that can support women on their breastfeeding journey. So I don't know if that addresses your question, Marie, or if you want more of the historical context. I don't have specific dates or timeline as to when those rates started to drop off.
Actually, I'm going to jump in because you hit a point that I was going to make into a question. You mentioned that the pain and supply problems are actually a big reason for lots of mothers discontinuing, and I was wondering, how does anybody that's interested in helping with that address that? Do you spread information about places where you can go for help? Do you increase the, I guess, the skill level or the resources of the places that are there for help? I mean, how do you help with that?
Right. So that was one of the things that we created. So that was that breastfeeding guide to community resources throughout the Monadnock region. So so moms would know where to reach out from help, and it could run the gamut. So there's lactation consultants. We have a robust lactation program at Cheshire Medical Center, at Monadnock Community Hospital. So there is also something that was established through the New Hampshire Department of Health and Human Services, and that was Zip Milk. So if a mother wanted to put in her zip code, she could find out where there are resources that are close to her. Certainly, if a mother is receiving benefits through the WIC program, they're an excellent source. There are peer counselors that are available through the WIC program. And there are also, there's La Leche, and there's also Breastfeeding USA. So these are kind of peer counselor type programs. But that was one of the things that we had compiled and put together. So that was specific to the Monadnock region. So moms knew where to reach out for assistance if they were struggling. So what kinds of tips and tricks and different strategies could be employed to ease that discomfort and pain, and to move through that. So so no one should have to suffer if they are struggling with breastfeeding efforts, because it's not easy. It's certainly there's many challenges that can come around from that, but they can be overcome in most instances.
Thanks. I've got a question about the list of childcare centers that have received awards.
Mm-hmm.
Do we have a list of that sort in
So we do, yeah. So if you go to the New Hampshire Breastfeeding Task Force website, so if you Google New Hampshire Breastfeeding Task Force and you go under, right at the very top, there's an area or a tab that says communities. It lists the recipients of the Child Care Award. And to date in our region in Cheshire County, we've had at least two, maybe three. I might be forgetting one, but we've had at least two recipients within Cheshire County who have received the award. And it's a 2-year award, and it's renewable after those 2 years.
Okay. Got a question about your priorities moving ahead, your research priorities.
So I think, my first priority is I would love to return to the e-learning program. So right now I'm finishing up a manuscript, and I'm going to be excited to share it with my colleagues. So Lynn would be one of them, Carrie would be the other one. So once that manuscript is submitted for publication, I would really like to return to the e-learning program and do some type of a qualitative survey with early childhood providers to find out what their experiences are, what the e-learning program could do for them, what we could do differently, and then look at assessing its effectiveness. So, we identified a number of limitations in the pre-post intervention or the pre-post test that we did. So certainly addressing those limitations that were in that particular research design, and then, moving forward to see how can we make some improvements and do some changes, and then look at the actual effectiveness of that platform. And that's something, there's very few research studies, especially current research studies, that look at the childcare environment and breastfeeding friendly practices. So, that's an area that I'm drawn to at this point. And, certainly narrowing in on an element of why we see lower breastfeeding rates in low-income women. I think food insecurity is certainly something that would be an interesting angle to examine.
Becky, if you don't mind me jumping in there
Sure.
for my question, and thanks for a great talk, really engaging. You mentioned over 1,200 participants in the E program. What's the demographic or the geographic representation within that group?
It's mostly all New Hampshire. So, and some might come back and return. So, whether or not it's, if it's 1,200 different participants, but 1,200 people have accessed it over the last, I don't know, 8 years or so. And it's all throughout the state of New Hampshire. And then, as I mentioned, we make it available for anybody. It's free. So anyone can enroll, anyone can do the training in the state of New Hampshire. It also can be applied to professional development hours, which are required for early childhood professionals to maintain their ability to work in the childcare environment. We don't have that kind of that reciprocity, so to speak, with other states. For the state of New Hampshire, we have it through New Hampshire Child Care and Licensing. So if other states want to come in and have their early childhood providers take that training, they're more than welcome to, but we can't provide professional development hours towards it, as we didn't go through that process for other states. So, and actually, next week I have a phone call with someone, I think in Nebraska, who wants to find out more about our training. So
that's great. I was interested if where folks participated, if that correlated with other data you had for counties in the state. But there's a lot of reasons how people enroll.
Yeah. So so I don't have that information in terms of the specificity as to what county they were located in. And if we were to look at that, we probably would have to be specific as to defining the county in which the child care program is located, and not necessarily where that individual lives, because it could be different. So yeah, so that would be some demographic information that we would collect for this next time around.
Thank you.
Okay. Got a couple more questions I want to throw out, a lot that have to do with external sort of environmental factors or other kinds of lifestyle factors. One is, do you encounter any moms struggling with initiating breastfeeding due to substance use? Is that a factor?
So, I don't work directly with moms, and certainly that was a question that we had in our WIC survey that we administered to the 283 participants. And we didn't find anything that shifted in one direction or the other with regard to substance use. So whether it was alcohol use or other drug use, so we didn't come across anything. But one thing that I neglected to mention in terms of the work that's happening in New Hampshire is that many of our healthcare centers or our healthcare agencies and hospitals, they embrace this kind of model of what's called eat, sleep, console. And it's for infants who are born to mothers, or the infants who have been exposed to substances, to drugs, and how they approach the care for those infants and using a non-pharmaceutical approach, and to really increase family involvement. So, if a mom is wanting to breastfeed and and has been using substances in the past, then how can we get the mom to that point? And I think a real popular question that tends to come up more often than not is the use of marijuana and breastfeeding. And certainly when we look at marijuana use, there hasn't been solid ground in terms of research that looks at it and how it affects breastfeeding, how it affects lactation. And because of that, it is discouraged that mothers who think that they want to continue marijuana use or engage in marijuana use, or perhaps even CBD oil, that because there's not a lot of evidence that is looking at how it might affect lactation or breastfeeding, it's discouraged to do so.
Okay. Got a question, a two-parter. One, will the presentation tonight be available for students who are unable to attend? Yeah, we are recording, and it is. We'll make it available. I'm not exactly sure how, but it's there. The second part is, has COVID-19 affected, I'm going to make it a big question. The question is, has it affected the initiatives around breastfeeding, but also has it just affected the number of people that choose breastfeeding? I can see it going both ways.
Yeah, so I haven't looked specifically at breastfeeding rates since COVID has started. You know, I would have to go back and look at that information. I'm not even sure what's available at this point. You know, certainly there's a lot of changes, you know, just thinking about the childcare environment, there are a lot of changes that have to happen in the childcare environment, and where typically you're dropping off at the door and picking up at the door. So, you know, when you're looking at having a space for mothers to come in or inviting mothers to come in and breastfeed or express milk throughout the day, that option has been minimized because of the pandemic. And then, you know, in looking at, you know, exposure with regard to COVID, you might think that that would preclude a mother from breastfeeding, and actually it does not. So, you know, mothers are encouraged, if they feel like they can, that they can breastfeed.
Okay. Got one more in the Q&A. Has anybody ever done research into stressful lifestyle markers and breastfeeding?
So in terms of whether that might affect a woman's supply?
I'm sorry, have you ever considered doing research into stressful lifestyle markers?
I think it would be an interesting opportunity. So, you know, it's not certainly something that I would not do, but in terms of looking at how that could perhaps affect a mother's milk supply, I mean, I think it would be a very interesting question to take a look at. Absolutely.
Okay. So I want to make sure that our panelists have all had an opportunity. If anybody wants to throw a hand up, on the raise hand thing, that's probably the way to go, because I can't see all the faces, and I want to make sure that I catch any questions from the other side of the audience. Anyone? No. Well, we all know where Professor Dunn works, and we all know how to reach her if we want to continue this. And with that in mind, and a thankfulness for leading off for us, I want to say very nice presentation, and thank you. So another round of applause that doesn't get heard by anybody, but it's there. And
thank you. I appreciate the opportunity.
Yep. And thanks everyone for coming. And we'll see you students next week, and hopefully some of you members of the audience too. Okay. And good night, everybody.
All right.